Today we're talking about the EZPap. Before entering a patient's room, we're going to go ahead and check the patient's chart, make sure there's no contraindications for this therapy. Those would include an untreated pneumothorax, hemoptysis, sinusitis, also any facial trauma. We can also, if the patient is hemodynamic instability, if their intracranial pressure is above 15, and active TB. So we also want to check the patient's chart to make sure they're alert and oriented. They do need to be an active participant in this therapy, so it's really important to make sure that they are. Check with the nurse on that. And then we'll also see if we can give them any aerosol medication when we do this therapy. So we can go ahead and cluster our care by doing it. We'll go ahead and collect our device and any medications that we need. Upon entering, introduce ourselves. Hi, I'm Kate with Respiratory. Today we're going to do some the EZPap, which is positive airway pressure therapy. What it's going to do is prevent and treat any atelectasis that you have. So opening up the alveoli in your air in your lungs and help you breathe easier. So we'll hook up this device to the air source in the wall or oxygen. Start them off on 5 liters. Instruct the patient to keep their mouth a tight seal around the device. And if they start breathing through their nose, we could put a little nose piece on as well. Or we could put a face mask, an adapter. If they're using an aerosol therapy, we could connect the aerosol treatment in between here and hook that up to the wall as well. The treatment only lasts a couple of minutes, but we'll be monitoring our patient throughout, especially the respiration. Patients can hyperventilate while they're using this, get lightheaded and dizzy, so we need to make sure we're watching our patient with that and that they're keeping that tight seal because the treatment doesn't do anything if you're just letting air escape. We need that positive pressure to get down into the lungs, into the airways, and open up those alveoli. And so after treatment, we'll go ahead and listen to our lung sounds again. Notice if there was a decrease in the work of breathing of the patient, and go ahead and leave this in the patient's room because this is a single patient use, and this will stay with the patient throughout their course of the stay in the hospital.